Luda, I'm just curious, have you treated anyone with sotorasib yet with KRAS G12C?
I just, so I have the adagrasib trial open at my site. So majority of my patients are getting treated with adagrasib. I just started a patient on lung map, and he is getting sotorasib. So yes, I do have one patient on sotorasib, but the rest of them are on adagrasib.
And is he doing okay on it? Tolerating it okay as far as side effects?
Tolerating it okay. We don't have the scans yet, so we don't know if the patient is responding, but tolerating it is okay. But definitely, looking in lung cancer, we are so spoiled by having good targeted drugs without side effects like osimertinib, alectinib, entrectinib. Certainly, KRAS drugs are definitely more toxic. I would absolutely agree with that. And diarrhea has been the most difficult to manage, but we can. So we do have medications that help with diarrhea. It's certainly, yeah, we kind of like, the glass, in my opinion, is half full rather than half empty. Because your alternative was, if you have a KRAS G12C, your alternative was docetaxel after you failed platinum doublet, and docetaxel 8.9% response rate, progression-free survival of 4 months, complete hair loss, nausea, neuropathy. So if I'm given a choice between sotorasib and docetaxel, I'll take sotorasib any day based on the side effect profile.
Absolutely. I mean, I think many of us were really excited when we saw, that the approval of sotorasib, and certainly with the data that we have with both sotorasib and adagrasib. For so many years, we thought KRAS was just kind of untargetable. And so it is exciting now to see that we can develop drugs. And, and what's becoming increasingly apparent is it's not just KRAS, it is specific mutations within KRAS. And then it's not even just specific mutations within KRAS, because you were just showing us the data that, patients with colon cancer who have this specific mutation or other tumor types may not respond as well to these drugs. And so there's something about the actual tumor type and the specific mutation, and it really does come down to personalized medicine.
Yeah, and I think kind of you are the patient's, we have to be our own advocates. So you have to study your cancer, you have to know what's going on in your cancer. I think one important question is ask yourself, have I been tested for any of those mutations? Do I know what my molecular testing is? Can I, if you don't have an access to your next generation sequencing report, ask your physician, where is my molecular testing? And if you haven't been tested, this is not the right thing to do. All patients with stage 4 lung cancer, especially if you do not have a squamous histology, need to be tested.
Agreed.